Yeah, I think we've had great data on Isatuximab. We've had a fabulous update on IKEMA, led by Philippe Moreau, and Philippe showed beautifully not only this dramatic progression-free survival of 36 months, but then when the FDA guided the censoring of data, or rather the removal of censoring of data in order to give the actual number, the progression-free survival was dramatic at 42 months. So I think we're seeing something from Isatuximab which is really quite impressive in the relapse setting. Our own data from ICARIA had led us in that direction with pomalidomide. I think the IKEMA data, though, are at a kind of new level, and they suggest that Isatuximab may have qualitative differences in terms of its impact in the relapse setting. Now, we have to be very careful because these are cross-trial comparisons, but for example, in CANDOR, the median progression-free survival was around 28 months. So again, with all those cautions, you've got to be careful about cross-trial comparisons because it depends how your control groups perform and the patient population enrolled, but nonetheless, a really nice signal there. So I think Isatuximab is showing us that it's not only basically well tolerated, it has all the upside of a CD38 antibody, very much like Dara. But my own personal view is that there may be qualitative differences, and perhaps some of these data reflect that. And that may lie in its effect in the T-cell microenvironment, as it were, and its effect on T-cells within the immune milieu. We have preclinical data to support that from my colleague, Dr. Yuzu Tai. And also my own sense of Isatuximab is this apoptotic pathway that it exploits may be particularly important. And there's this ectoenzymic idea with a different epitope that it binds to compared to Daratumumab that I think really potentially has merit. And so this data that shows that clinically and is exemplified by IKEMA and hinted at by ICARIA, I think is really exciting. And then of course we have the upfront data from our German colleagues, which are really interesting. And RVD Isatuximab pre-transplant, the MRD negative rate, solid north of 50%. I mean, that's impressive. And that's again without transplant. So Isatuximab, I think, continues to be very exciting, and going forward we'll look forward to more information coming from studies that are going on with Isatuximab in the upfront setting.